The distinct pleasure of chatting with one of the amazing and committed professionals over at Bristol Hospital. Well, today we're going to talk about physical therapy. We're going to talk about some winter sports injuries, and I'm so pleased to have the chance to welcome to our show. He is a physical therapist with Rehab Dynamics of Bristol Hospital, Jared Parker. Jared, good afternoon.
Good afternoon to you, Mary. How are you today?
Well, I'm doing great. Happy holiday season to you, Jared. I'm so glad that we could have a few minutes of your time today.
My pleasure. Now,
physical therapist, just in general, that is a profession that I continue, Jared, year in and year out to read that it's a great profession in terms of their opportunities there, the demographics of our country. I guess there is a lot of need for good physical therapists. So you chose very well.
I'd like to think so, yes. It's been a fantastic career for myself to this point, certainly.
And certainly being fortunate enough to work at Bristol Hospital, that just makes it extra special.
Yes, it does.
So let's talk about some typical sports injuries that you treat, and I know there are a lot of them during the winter months. Give us a feel for what sort of things you see and work on, Jared.
Yeah, typically this time of year, people will start obviously partaking in winter activities and sports. Some of the more common injuries that we'll see as a result, really range anywhere from your typical sprains and strains, and that can be, something as common as an ankle sprain or a knee, sprain or strain, as well as anything like a elbow, shoulder, or a wrist and hand fracture, from a fall. So it can really vary, as you say.
Well, just when you said that, two things came to mind in terms of two culprits. One being shoveling snow,
sure,
where you could very easily just take a spill, and before you know it, you've sprained or fractured something. And then just anyone walking down the street, this is the time of year, and today's a great day to be having this conversation, yes, Jared, in terms of there's some ice and just taking a spill on the sidewalk, on your driveway, in a parking lot. That's all you need to have happen.
That's right. Yeah, unfortunately.
Yeah, exactly. So if someone does take a spill, whether it be sports injury, skiing, or a little closer to home, shoveling out your driveway, what are some of the symptoms that we should be aware of and maybe look out for?
Yeah, initially it's certainly going to be pain and swelling, in the given area. First step would be to, rest, ice, elevate, get off of that, extremity, whether it's, obviously a foot or ankle or, in any case, an arm. We recommend that if you have pain that's limiting your, ability to function on a day-to-day basis or with your normal daily activities, you should definitely seek some medical attention at that point.
Absolutely. Now, you mentioned, I'm smiling here, Jared, speaking with Jared Parker, physical therapist with Rehab Dynamics at Bristol Hospital. You mentioned rest, ice, and elevate.
Correct.
I'll just speak for myself, but I am always confused about whether there's an injury, whether we should give it ice or heat. But you're saying if there's swelling, ice is normally the way to go.
That is correct. Yeah. Initially, if you have any acute swelling, which is swelling in the beginning phases of an injury, you want to definitely apply a cold type of therapy. Ice is kind of the most common way to do that.
And the sooner we do that, the better?
Correct, yeah. It's going to help to reduce that initial swelling, as well as help with the pain.
Okay, good. Boy, I'm glad we're having this conversation because that's always been a dilemma for me. Do I apply heat? Do I apply ice? So that's good to know, Jared. So let's look at it in terms of, as you initially started talking about sports injuries in the winter and some athletes, as opposed to just those of us shoveling the snow out of our driveway. Are there any preventive measures that athletes can take to prevent some of those injuries?
Yeah, I mean, first and foremost, I think it's very, very important if you're going to be participating in a winter sport, like skiing or snowboarding or sledding, even ice skating, maybe not so much, but proper headgear or, the use of a helmet is very, very important. We want to definitely try and do anything we can to prevent head injuries. But, in terms of trying to, eliminate your more sort of, orthopedic injuries, your muscle and, strains and sprains like we've been talking about, definitely don't begin an activity cold. You definitely want to try and do at least a few minutes of some type of warm-up activity prior to initiating the winter sport.
Speaking with Jared Parker, physical therapist over at Bristol Hospital. Now let's get to the nitty-gritty, if we can, Jared, in terms of what you as a physical therapist can do in terms of how some of those injuries are actually treated.
Yeah, essentially we're going to go through our typical evaluation, depending on what the injury is that the person comes in, presenting with. And we'll essentially address any impairments that we find. If you use an example of, say an ankle sprain, we're going to try and do some things to help with, that initial swelling as well as pain. Certain treatments that we can use, include the heat and cold modalities as we have discussed, as well as using something such as pulsed ultrasound to help try and remove some of the swelling from the joint. And then it's just a matter of trying to restore range of motion. And eventually, as symptoms improve, try and regain some of the strength that can be lost, in the interim.
And depending, of course, on the injury, you would then make a decision in terms of how many treatment sessions that person would require.
Yeah, that is correct.
And it could be anywhere from one to many more, obviously.
Yeah, absolutely. I think a typical, kind of soft tissue injury, again, a sprain or a strain, healing time for that is anywhere between 4 to 6 weeks on average, for all of that, the damage that was sustained to be completely healed. So, you don't necessarily have to be involved in a skilled therapy program the entire time. Some people certainly do, but we're gonna spend as much time with you as we need and get you back, in that case, obviously on your feet and feeling better.
Well, and that's kind of the bottom line. And the good news is, and we like the good news around here, Jared.
That's right.
The good news is that through physical therapy, when it's done by someone who is as well trained as you are and certified in that, it has remarkable results.
It does, yeah. Can be very, very effective, certainly.
No, Jared, I'm going to put you on the spot for a moment.
Sure.
Well, my guess is you can probably answer this question. The difference between physical therapy and occupational therapy?
Certainly depends on the setting, I would say. In our setting, in outpatient orthopedics, we have an occupational therapist that kind of focuses on elbow, wrist, and hand. We have a certified hand therapist in the clinic that will focus on those areas of treatment, and they certainly get specialized education for that and training. As a physical therapist in an outpatient orthopedic setting, we're kind of seeing a little bit of everything else. Anything from head and neck injuries all the way down to, again, the foot and ankle sprains, and pretty much anything in between.
Interesting. I never really knew what the difference was. Do you, as a physical therapist, you mentioned something earlier. I don't remember what it was. I think it was the name of a machine that you use to assist with swelling. Yeah,
we use certain what we call modalities, which are treatment options to help with things like swelling as well as pain. One of the ones we had spoken about earlier is ultrasound machine.
Oh, ultrasound. Okay.
Yeah, and that can be used for kind of mainly two purposes, depending on how we set the machine up. One is to apply deep heat to a larger muscle, or a group of muscles, to help improve circulation and assist with stiffness, I suppose. And the other setting or purpose is to help basically help to eliminate swelling within a joint space or area.
So all of that was to ask the question, and you've kind of answered it. Thank you for that. In terms of there are some sophisticated machines and devices that you can work with people on.
Yeah, there certainly are. Correct.
How long have you been a physical therapist at Bristol Hospital?
I've been with Bristol Hospital now for almost 2 years, and I've been a therapist for almost 9.
Really? Oh.
Yeah.
Are you from Connecticut originally, Jared?
No, I'm originally from New Hampshire, actually.
You are? Oh, and you want to move south.
Move south. That's where my wife said that I needed to move to.
Oh, really? Well, we're glad you listened to her.
That's it.
Oh, that's great.
As am I.
That's right. Jared with 2 R's, Jarred, Parker, physical therapist with Rehab Dynamics right over at Bristol Hospital. Do check out their website. They have loads of information on all the services, the clinics that they offer. It's bristolhospital.org. bristolhospital.org. Could you share a phone number into your Rehab Dynamics department, please?
Sure can. It's 860-589-3587.
That's 860-589-3587, and that is right into Rehab Dynamics?
That is correct.
Is that right? And at Rehab Dynamics, just another question, Jared, and then I know you need to run. There is a staff of physical therapists. You also have occupational therapists. Are there other modalities that are part of Rehab Dynamics?
We do also offer as a specialty speech-language pathology at one of our off-sites as well.
That's wonderful. So speech pathology, right. Physical therapy, occupational therapy. You got it all covered over there, Jared.
I think so.
That's great. 860-589-3587. Again, their website is bristolhospital.org. Jared, thank you so much for joining us today.
Thank you. It was my pleasure.
Have a very safe winter.
You as well.
Thank you. And that is Bristol Hospital. They have such wonderful professionals over there. I'm so glad to be able to chat with some of them with some regularity. And we do want to take away from that conversation not just all that physical therapy and Bristol Hospital has to offer, but safety first. I hope, I will admit, I am very mindful of things around the house like walking on snow, shoveling, walking on ice, anything that could easily, without your even knowing it, lead to a spill or a fall or a little accident. Very mindful of when I'm in those situations, just proceeding very slowly. Because oftentimes when you don't, when you're driving too fast, when you're walking too fast, when you're thinking of something else, when your attention and mind are not focused on what you're doing, that's when things can happen. So do pay attention to that all the time. All the time. Jared Parker, Bristol Hospital, 860-589-3587. We'll take a break. We will be right back. I hope you're having a great, safe, dry, toasty, warm Tuesday. Stay with us.
You're listening to The Mary Jones Show on the Talk of Connecticut.